I was diagnosed with leg calf perthes at 4.5 years old and knew from that point that eventually I would have to have a hip replacement. As my life went on, pain became more a part of my life, and to the point where I would have to lift my leg to get inside a car, or know that if I had any kind of physical activity, that meant that for the next few days after that, I was going to be very limited. So the pain presented like arthritis in a severe form. Range of motion very limited, but I didn't try to let that stop me at all. Still climbed trees, did all the things that my doctors told me not to do. So that was running activity, jumping. I played baseball as much as I could, anywhere I could. But that had its limiting effects. Constant pain. I didn't know what a day without pain was like. So I went to AppOrtho after an injury related to the hip condition, and Dr. Bullers immediately went and got Dr. Anderson. He came out of a meeting and said, I knew I'd see you here soon, but he said, you present all of the circumstances that it's right to do this now. Your quality of life is deteriorating, you're in constant pain, let's consider this. So after that quick evaluation and some follow-up, we scheduled surgery as soon as we could. And that was a full 10 years ahead of time, where I thought that I would be. And then as we began to talk about that process, it hit home immediately that I would have surgery in Boone, rehab in Boone, post-op care in Boone, all within 5 miles of my house. I grew up thinking that I was going to a destination medical facility to have a procedure like this from the time I was 4.5 years old till the time I walked into AppOrtho. And as they were able to lay out what that process would look like, I went from trepidation about having surgery to let's get this thing done. Let's get on the schedule and begin to unlock all of the things that I know now to be my normal life. The experience was unlike anything I could have imagined, and from the time that I went in for surgery to the time that I graduated rehab was less than 3 months. And with that immediate relief in pain, when I walked for the first time, after the initial journey post-surgery, I was, just about moved to tears because it didn't hurt anymore. And I was able to push myself physically for the first time in a long, long time. And that was when I thought, hey, this psychologically has already changed me. I feel like I can do more. I also learned that the boundaries that I'd had for my entire life didn't exist anymore. And as I moved through rehab, I was able to continue to push that. To now, post-surgery, I've dropped 40 pounds. I've gotten into a normal routine. I can work out on back-to-back days and not flinch about that. Never did I think that I could have all of that done at the time that I did in my life and in my own backyard, and that made all the difference for me.